Hello everyone and welcome to the OncoAlert Weekly Round Up. I'm your host Gil Morgan, reminding you that these are just some of our picks, and for a deeper look, we invite you to subscribe to our newsletter through our website at www.oncoalert360.com or through the link or the QR code in this post. That's www.oncoalert360.com. Now let's dive into the latest findings by tumor group. In lung cancer, starting with a meta-analysis in the Lancet Oncology, which looked at dual CTLA-4 plus PD-L1 or PD-1 blockade versus single-agent PD-L1 PD-1 inhibitors in advanced non-small cell lung cancer. Overall survival wasn't improved in the general population, but subgroups told a different story. Patients with PD-L1 low tumors and those with STK11 mutations saw meaningful survival benefits, suggesting that dual checkpoint blockade should be reserved for these specific groups. In the resectable setting, a pooled analysis from 11 trials confirmed that neoadjuvant or perioperative chemo-immunotherapy significantly improved both event-free survival and overall survival compared with upfront surgery or adjuvant immunotherapy, even in stage 2, PD-L1 negative, and squamous tumors. So in lung cancer, the right treatment at the right time and for the right patient makes all the difference. Turning to breast cancer and in news from industry, the Destiny Breast05 trial reinforces the value of trastuzumab deruxtecan in HER2-positive early breast cancer patients with residual disease post-neoadjuvant therapy, showing significant improvements in invasive disease-free survival over T-DM1. Meanwhile, the 4-year follow-up from the NATALEE trial showed that Ribociclib plus endocrine therapy maintains a durable benefit in hormone receptor positive HER2 negative early breast cancer without new safety concerns. On the clinical management side, a practical review on sacituzumab govitecan highlighted strategies to manage neutropenia, diarrhea, and fatigue, ensuring patients can stay on therapy. Finally, pooled European cohort data shows that higher BMI increases postmenopausal breast cancer risk, especially in women with cardiovascular disease, underlining the intersection of comorbidities and cancer risk. And in GI oncology, 2 studies on CLDN18.2 positive gastric cancers. First, sulbatuximab containing chemo regimens frequently induce early onset gastritis, which was generally transient and manageable without discontinuing therapy. Second, CLDN18.2 expression itself is dynamically regulated during chemo-immunotherapy and correlates with an immune-inflamed stroma-rich microenvironment, suggesting that serial biomarker monitoring could help guide therapy. And in GI oncology, the Progress Registry showed that patient satisfaction and perceived benefit of prostate cancer germline testing are highest with personalized counseling, though disparities exist among Asian American men. Meanwhile, survivorship studies highlight the mental health burden. Cancer survivors are more likely to use antidepressants and anxiolytics, but access is influenced by race, insurance, and cancer type. And in gynecological oncology, high-grade aggressive endometrial cancers demonstrate striking heterogeneity. Survival outcomes vary by subtype, emphasizing that these tumors should not be treated as a single entity. So this week's takeaway across tumor types is clear. The future of oncology is increasingly nuanced. Whether we're selecting patients for immunotherapy, tailoring adjuvant strategies, or monitoring dynamic biomarkers, precision, driven by biology, risk, and patient characteristics, is key to improving outcomes. And that's it for this week's Weekly Roundup. I'm Gil Morgan. I'll see you next week with more updates from the world of oncology.